Hello, welcome back to your weekly address in my recovery room. Of course, I'm Lucius Conway, certified recovery peer advocate for all that's worth and manager of Recovery Coaching Service of New York. This week, I'm asking you to do something very, very important. A guy by the name of Michael Botticelli. Michael Botticelli is the United States drug czar. He's over President Obama's Office of National Drug Control Policy. I want you to get in touch with him. I want you to also get in touch with Governor Andrew Cuomo. That's New York State Governor, that's right. And there's a person he appointed, and her name is Commissioner Arlene Gonzalez. Lots of names, you know. The wheels of bureaucracy grind slowly because there are layers, and these layers are under people. And then under her, there's a woman named Patricia Lincourt. Okay. These four individuals hold the key to releasing Recovery Coaching Service of New York to contract with Optum Health and to provide certified recovery peer advocate services throughout the continuum of care to people who are suffering from substance use disorder, as well as to help the numerous people who have taken Recovery Coach Academy training actually get their credentials and get to work in the field. In New York State, we have over 500,000 people who are dealing with substance use disorder directly. God only knows how many more are impacted in terms of family, friends, and society at large. It has been proven scientifically through numerous federally sponsored tests and research, as well as locally sponsored research actually performed by Optum Health over the last 2 years. The results revealed that utilizing peer advocates in mental health environments for mental health patients, as well as in substance use disorder environments for people dealing with addictive disorders, is the, in their words, game changer. It increases engagement, it increases compliance, meeting your doctors, making your appointments, taking your medicine, and reducing significantly healthcare costs. Yet, 2 years after this research has been completed, New York is still dragging her feet. On January 1st of 2014, all certified recovery peer advocates were supposed to be in the outpatient clinics. It is June of this year, mid-June. No certified recovery peer advocate is currently receiving any Medicaid reimbursement for any services provided in any facility throughout the state. And despite the large number of people suffering from this disorder, the enormous amounts of money being thrown at trying to treat the problem in a traditional way, we're still at square one, it seems. There are 50 of us. I say us because I'm one of them. I'm one of 50 out of more than how many millions of people live in New York State. I'm one of 50. There are only 50 certified recovery peer advocates in the entire state, and none of us are employed in any outpatient clinic pursuant to our state law. We have to be employed or working out of these outpatient clinics in order to get the Medicaid reimbursement, which averages at about $22 an hour. We don't get it. They don't hire us. I've had providers tell me there's no way for us to make money off of you guys. So if we bring you in and hire you and you do the Medicaid reimbursement, we're going to lose money on fringe benefit packages, etc. Thus, what I've suggested and continue to suggest is subcontract with Recovery Coaching Service of New York, and you won't lose money. However, you still won't turn a profit. That's true. And that's their issue. They can't turn a profit. They're afraid. Some of the drug counselors are afraid that because by nature peer providers like myself, certified recovery peer advocates, would have to take on a level of responsibility in terms of the case management, as well as documenting exactly what their encounters reveal. And if it is discovered and or determined that we are peer advocates, the game changers, it stands to reason that there would be a reduction in healthcare cost and expense for the services of counselors and MDs, etc., throughout the system. So the system itself, despite the science, despite best practices, despite the evidence, is still resisting letting us in to help us, addicts helping addicts. Okay, it's unfair. It's irresponsible. Who can do something about this? You. You can. Because everybody that's responsible for keeping us out, you and me, we vote in to that position. Which is to say, Congressman Charles Rangel or Congressman Espelot, if we elect him this term, will have a vote on that issue in the House. Our senators, Schumer, will have a vote on that issue in the Senate. Of course, the good president has a tremendous amount of influence over his Office of National Drug Control Policy, as well as the CMS, which is the Medicare federal arm that sets a whole lot of rules regarding who can bill and who cannot. And at this point, Optum Health has presented me with a contracting opportunity. All of the paperwork is completed with one exception, one glaring exception. They will not give Recovery Coaching Service of New York a Medicaid number by which to bill because Medicaid says you have to be licensed, a licensed practitioner. Well, I have a certification. We are non-traditional certified providers, not licensed providers. However, the Social Security law does allow for waivers under certain circumstances and in certain instances, such as the 1915 I waiver, which some states are actually using to pay peer provider entities like RCS to provide direct services to their peers. I had a doctor tell me here in New York City, oh, well, we don't want peer agencies to bill directly because there's the issue of whether or not they can be trusted to not defraud Medicaid or Medicare. Whose history is it of defrauding Medicaid and Medicare? The licensed professionals, not the non-traditional. They're the ones with the bad track record, not us. Why should we be penalized, we who have been trained, who are proven scientifically to be more efficacious in reducing healthcare costs, but more importantly, aiding people in entering into recovery and living lives of wellness beyond mental health issues and substance use disorder? It's up to you. You know, you can make a difference. I don't know if it's because I'm black look, I know it's 2014, but you know as well as I do, racism is still a very real reality. I'm a guy from the street. I don't have an alphabet soup behind my name. But I do and have created scientific methodologies that have been recognized internationally within the addiction, therapeutic, and research community. Okay? Now, of course, the organization, Omics Group, that did acknowledge and does acknowledge me is a group headed by people of color. Indians and Pakistanis are people of color. But the people in charge of New York State and how it runs are Anglos, white folk, and Latinos who have light skin. There are none of us darker people running things up there. So the people that's in charge of this are people without the skin color. And I believe that factors. And the fact that Optum Health themselves have told me, listen, if they can give you a Medicaid number, we can refer as the managed care organization for New York City, as well as the behavioral health organization for New York City, we can provide you with enough funding that you'll never have to worry about money again. And your organization is in a prime position to actually become a very lucrative business. How do you think the establishment looks at that kind of a prospect, considering it's me? Who cares how they look at it? Do we really care about reducing healthcare costs? Do we really care about helping people with mental illness and people with substance use disorder get their lives back? Do we really care about those things? If we really care about those things, then we need to contact Governor Cuomo. We need to tell him to put pressure on Commissioner Sanchez Gonzalez, to tell Pat Lincourt to use the 1915 I waiver, give RCS a Medicaid number so that we can fulfill the contract with Optum Health so that that contract can be executed. If the MCO sees the value in a peer provider entity and has created a peer provider vendor position within the network of care, why in the devil is the state dragging their feet? Because they don't want to see us. In particular, I'm the only player in the game here in New York State. So I've got to assume they don't want to see me advance. Listen, get on your phone, get on your email, call everybody you know and tell them tell Congressman Rangel, tell Governor Cuomo, tell Commissioner Sanchez-Gonzalez, tell Pat Lincourt, tell Mike Botticelli, and tell President Obama himself, give that guy the Medicaid number so that he can do what we know he has proven he can do to help reduce healthcare costs and bring health, wellness, and recovery to those who so desperately need it within both the mental health and behavioral health or addictive disorder continuums of care. This is Lucius, and as usual, above all things, I wish you and yours wellness.